Welcome to the deep dive. You know that nagging thought you sometimes get when your upper back feels a bit rounded
Hmm.
and you think, that's why my shoulder hurts.
Yeah, I know the feeling.
Well, we're diving headfirst into that today. The connection between that upper back posture,
Hmm.
doctors call it thoracic kyphosis, right?
That's the one, thoracic kyphosis.
And shoulder pain, shoulder movement.
Yeah.
It seems like they should be linked, doesn't it? Like everything's connected in the body.
It absolutely feels that way, and it's a really, really common idea. But, like we always do, we're not just going to rely on what feels right.
Right. Got to check the evidence.
Exactly. We've really dug into a systematic review here. Think of that as looking at a whole bunch of studies together to get the clearest picture.
Okay.
And this one looked at 10 different studies involving, wow, nearly 2,800 people. Almost 2,794 to be exact.
Wow, that's a lot of people.
It is. So our goal is really to see what the hard evidence actually says about this connection.
Okay, so we've got studies comparing people with shoulder pain to those without, and others that actually got people to change their posture to see what happened.
Yeah, exactly that.
So our mission today, unpack the research, see what's really backed by science and what might just be, an assumption we all make.
Let's do it.
Okay, so first big question. Is there really a difference in that rounding the kyphosis between people who actually have shoulder pain and those who don't?
Okay, so this is where it gets pretty interesting and maybe a bit surprising for some.
Oh.
The overall finding, based on what the review calls a moderate level of evidence, suggests, well, no significant difference.
No difference.
Not a significant one, statistically speaking. Several studies, and importantly, some of these were rated as having a low risk of bias, meaning they were pretty well-designed studies.
Okay, good quality stuff.
Right. They found no real difference in how rounded the upper back was between the group with shoulder pain and the group without. We're talking studies by Lewis and colleagues, McClure, Theisen. Even a solid, low-risk study didn't find that strong link.
Huh. So all that time I spend trying to sit bolt upright?
Yeah.
Maybe not directly fixing the pain itself.
It certainly makes you think, doesn't it? The evidence suggests that just having a more rounded back might not be the main driver for shoulder pain for many people.
Okay. But you said several studies. Was there anything pointing the other way?
Well, yes. There was one study by Otoshi and team in 2014. Now, this one was rated as having a higher risk of bias, so maybe we take it with a slightly bigger grain of salt.
Got it. And what did they find?
They did find a connection. They used something called the wall occiput test, or WOT. Basically, can you stand with your back to the wall and touch the back of your head to it easily?
Oh, I've never tried that.
Right. And they found that people who couldn't easily touch their head to the wall, suggesting maybe a more rounded posture or limited movement, this was more common in the group with shoulder pain.
Okay, so one study says yes, others say no. Why the difference? Is it just a bias thing?
That could be part of it, but there's another angle. The researchers themselves pointed out that the wall occiput test, it might not just be measuring your static posture, like the curve of your spine when you're just standing there.
What else would it measure?
It might also reflect how well your thoracic spine can move, specifically extend or straighten. So it's potentially measuring a mix of posture and mobility.
Ah, okay. So it's not quite comparing apples to apples with the other studies that just measured the static curve?
Exactly. It's a bit different. It kind of highlights how tricky measuring posture can be.
Makes sense. So if we're saying posture, or at least static posture, isn't necessarily the main culprit for shoulder pain, what else is going on? Especially for people with pain that just won't quit.
That's the million-dollar question, isn't it? And the likely answer is, it's complicated. Shoulder pain, especially chronic stuff like pain lasting longer than 3 months, which many studies look at, it's probably multifactorial.
Meaning lots of things involved.
Precisely. The review mentions possibilities like mechanical overload, just using the shoulder too much, or in stressful ways, degenerative changes, wear and tear over time.
Yeah.
Even genetics and lifestyle factors could play a part. And importantly, especially with chronic pain, the central nervous system itself can become involved.
How so?
Your brain and spinal cord can become more sensitive to signals, almost amplifying the pain message. So the pain experience isn't just about what's happening physically in the shoulder joint anymore.
Wow. Okay, so it really isn't just fix your posture, fix your pain.
Seems unlikely to be that simple for everyone based on this review.
All right, so that covers whether people with pain have worse posture. What about flipping it? Can changing your posture, like consciously sitting up straighter, affect your shoulder? Let's start with function ability to do things. Did the review look at that?
Interestingly, no. None of the 10 studies in the specific review actually looked at whether changing thoracic kyphosis, making your upper back less rounded, directly improved shoulder function, like lifting groceries or reaching high shelves.
Huh. That seems like a pretty important piece of the puzzle, right?
It really does. It feels like a gap. If posture change was a major fix, you'd expect studies testing if it helps you do more.
Yeah, exactly. Why do you think that hasn't been studied much, at least in this review scope?
That's a great question. Maybe it's harder to measure function reliably in a lab setting compared to, say, range of motion. Or perhaps the focus has just been elsewhere.
Okay, so no direct evidence on function in this review. But what about range of motion, just how far the shoulder can move?
Now here the evidence is much clearer and stronger. There's strong evidence that actively adopting a slouched posture, so increasing that upper back rounding on purpose, it's associated with reduced shoulder range of motion.
So slouching makes you stiffer.
In terms of how far you can lift your arm, yes. Specifically for flexion, which is lifting your arm straight forward, and abduction, lifting it out to the side.
And this was true for everyone, people with and without pain.
Yes, the findings applied to both pain-free individuals and those who already had shoulder pain.
Okay, that's a key takeaway then. Even if it doesn't immediately change pain, slouching can physically limit your shoulder movement.
Exactly. It's an immediate mechanical effect, it seems.
Were there specific studies that really nailed this down?
Oh, absolutely. There was a good low-risk study by Catalina Footporn, great name, huh?
Yeah.
In 2014, they looked at healthy men. When they sat with less thoracic kyphosis, so more upright,
Yeah.
their shoulder flexion, abduction, and even external rotation, turning the arm outwards, all significantly improved. They could just move further.
Wow. More range just by sitting up a bit straighter.
Pretty much. Interestingly, though, they found internal rotation, turning the arm inwards across your body, actually increased a bit with slouching. A quirky little finding.
Huh. That is odd.
Yeah.
But mostly sitting straighter freed things up.
That was the main trend. Another study, Kyphosis and colleagues back in '99, also found healthy folks could lift their arms significantly further out to the side, abduction when they were sitting erect compared to slouched.
Okay.
And then, moving to people with shoulder problems, a low-risk study by Bullock and team in 2005 looked at people with subacromial impingement syndrome, a common cause of shoulder pain.
Right, where things get pinched.
Exactly. They found that sitting more upright significantly improved how far these individuals could lift their arm forward, their flexion range.
Okay, that makes sense. Did it help their pain when they moved further?
Now that's the really interesting part. In that Bullock study, even though the range of motion improved in the upright posture, the pain intensity they felt during that movement wasn't significantly different between sitting slouched or erect.
So they could move more, but it didn't necessarily hurt less right then and there.
Correct. At least not significantly in that immediate test.
That's really important to distinguish. More movement doesn't automatically equal less pain, at least not instantly.
It seems so. And there's more evidence backing this up. Another low-risk study, Lewis et al., 2005b, used tape. They applied tape to the upper back and shoulder blades to kind of encourage a more extended upright posture.
Okay, like a physical cue.
Exactly. And they found this taping led to significantly greater shoulder range of motion compared to just resting normally. This was measured up to the point where pain started or got worse in the impingement group and just maximum range in the pain-free group.
In the pain levels.
Again, similar to the Bullock study, the actual pain ratings weren't significantly different between the taped posture and the normal resting posture, even though the movement increased.
Fascinating. So consistently, changing posture seems to unlock more movement almost immediately, but the pain component is less clear-cut in the short term.
That appears to be the pattern from these studies, yes.
Okay. So why? Why does slouching restrict movement? What's the proposed idea?
The main thought mentioned in the research is about the scapula, the shoulder blade.
Okay.
When you slouch, your whole upper back rounds forward, right? This can cause the scapula to tilt forward and maybe rotate downwards or forwards on the rib cage.
And that gets in the way.
Potentially, yes. That altered position might act like a mechanical block, physically limiting how far the humerus, your upper arm bone, can move before something bumps together or tissues get compressed.
Like the shoulder blade literally blocking the arm's path.
That's the proposed mechanical explanation, yeah.
Okay. Now, were these studies making people slouch, like, ridiculously, or
That's a fair question. Many of them did use fairly distinct, maybe even exaggerated slouched versus erect sitting postures to make the comparison clear.
Right. Not necessarily how people slouch naturally all
I
day.
mean, not quite as extreme. However, that Lewis study using the taping, that suggested that even relatively smaller changes in thoracic kyphosis, the kind induced by just tape, could still have a significant impact on range of motion.
Ah, okay. So it doesn't have to be a massive posture change to potentially affect how your shoulder moves.
It seems even subtle shifts can matter for range of motion, yeah.
Good to know. So that's about changing posture. What about just someone's usual everyday resting posture? Is there a link between how rounded someone's back usually is and how much shoulder movement they have?
They looked into that too. One of the Lewis studies, the 2005A one, actually found a pretty poor association. Weak link.
Weak link between their normal resting posture and their shoulder rump.
Yes, in both people with and without that impingement syndrome. So just looking at how rounded their back was at rest didn't strongly predict how much shoulder movement they had.
But what about that outlier study, the Atoshi one with the wall test?
Right. Remember that one linked to positive wall occiput tests suggesting more kyphosis or less mobility with shoulder pain? Well, that study did report a significant link between having that positive WOT and also having restricted shoulder flexion, specifically less than 150 degrees of forward lift.
Okay, so again, that WOT measurement seems to pick up something that correlates with both pain and restricted movement, but it might be more than just static posture.
Exactly. It muddies the water a bit regarding pure static posture, but it's an interesting finding nonetheless. It hints that maybe mobility or the ability to get out of that kyphotic posture is important.
Right, right. Okay. So pulling this all together, what are the big takeaways for, someone listening who's got shoulder pain and keeps hearing sit up straight?
Okay, let's distill it. First, based on moderate evidence, just having a more rounded upper back when you're relaxed probably doesn't automatically mean you're destined for shoulder pain. The link isn't that strong in terms of resting posture predicting pain.
Okay, that's big. What else?
Second, there's strong evidence that actively changing your posture, specifically moving from a slouch to a more upright position, can immediately increase your shoulder's range of motion, especially lifting your arm forward and sideways.
But
But third, that immediate increase in range of motion doesn't necessarily translate to an immediate significant reduction in pain, at least based on the studies we looked at here.
gotcha. Movement improves, pain. Maybe not right away.
Precisely. So it means we need to be cautious about assuming that just correcting your thoracic kyphosis is the magic bullet for shoulder pain. The current evidence doesn't fully support that simple equation.
So what's a practical way for someone to use this info
Mm.
if they have shoulder pain?
Well, one thing you could try, sort of a self-experiment like you said earlier.
Yeah.
Just notice what happens to your shoulder symptoms when you consciously change your posture for a moment. Try sitting a bit taller. Does it feel easier to move? Does the pinch feel less?
Like a quick personal check.
Exactly. This idea is actually part of a clinical approach some therapists use called the Shoulder Symptom Modification Procedure, or SSMP. You basically test out small changes, posture, how you move your shoulder blade, etc., and see if anything immediately makes the painful movement feel better.
So if sitting straighter does seem to help your specific pain right then,
Then that's valuable information for you. It might suggest that, for your shoulder, postural strategies could be helpful as part of a broader approach. It gives you a personalized clue.
that makes a lot of sense. Run your own little test.
Yep. And another really crucial thing to keep in mind, especially if the shoulder pain has been hanging around for a while.
The chronic stuff.
Right. Remember that central nervous system sensitization we talked about?
Yeah, the brain amplifying things.
It's vital to consider that the pain might not just be coming from the shoulder joint or the posture. Central mechanisms can play a huge role. Thinking about this helps tailor assessment and treatment more effectively, looking beyond just the local mechanics.
So the message isn't simply sit up straight. It's much more nuanced.
Definitely. It's more like your static posture might not be the main pain driver, but changing your posture might affect your movement, and maybe test if changing it helps your symptoms while also considering other factors, especially if the pain is chronic.
Haha, not quite as catchy, but probably more accurate.
Probably. And it also tells us where more research is needed.
Like what?
We really need more high-quality studies, especially prospective ones, studies that follow people over time before they develop pain, to see if posture truly predicts or leads to shoulder problems down the road.
Cause and effect, basically.
Exactly. And it would be incredibly valuable to see studies directly comparing shoulder pain treatments that include specific postural correction versus treatments that don't, to see if adding the posture focus actually makes a difference in outcomes like pain and function long term.
Yeah, that would be super helpful for clinicians and patients. Okay, so let's try to sum up the main points one last time.
Okay. Moderate evidence suggests your typical resting upper back curve isn't strongly linked to having shoulder pain.
Right.
But strong evidence shows that adopting a more upright posture can immediately improve how far your shoulder can move.
Okay, and the caveat.
The clinical significance of that improved movement for long-term pain relief and better function. Well, that remains unclear from this review. We don't know for sure if that temporary ROM boost translates into lasting benefits.
Got it. Resting posture and pain. Weak link. Changing posture and immediate movement. Strong link. Changing posture and long-term pain function. Jury's still out.
That's a fantastic summary, and it leaves us, and you listening, with a final thought to chew on.
Lay it on us.
If static posture, just the shape of your back when still, isn't the primary driver of shoulder pain for many people, what else in our daily movements and habits might be more crucial?
Like how we move, not just how we sit.
Exactly. And maybe what role does the mobility of the thoracic spine, how well it can actually move and adapt, play, rather than just its resting curve? It pushes us to think beyond simply sitting up straight.
Interesting. More about dynamic movement and capability rather than just static shape. Definitely something to think about.
For sure.
Well, thanks for digging into this with us today. Hopefully this deep dive has shed some light on that complex relationship between your upper back and your shoulders.
Hope it was helpful.